Basketball might be one of the most high-risk sports for your teeth. Accidents from a hurling ball or a rogue elbow can result in a serious injury, like with Wilson Chandler here, who was playing for the NBA.
Oh, the elbow goes right into his mouth. I think he lost a tooth.
But right now, the development in regenerative medicine using stem cells could make losing your tooth an easy fix. If you lose a tooth, the three most popular options people take to fix their tooth problems are getting dentures, dental bridges, or dental implants. They're effective, but they do have their consequences. The first option is to get dentures. They can be temporary or permanent and can replace one or many missing teeth. However, dentures could be visible when speaking or smiling. Furthermore, they can move a little when speaking or eating, which can be uncomfortable. The second option is to get dental bridges installed in your mouth.
Un pont fixe est une option pour remplacer une ou plusieurs dents manquantes. Les dents naturelles à côté de l'espace édenté sont taillées et servent de piliers pour le pont. Un pont de minimum de 3 couronnes fusionnées ensemble est alors cimenté sur ces dents piliers.
As such, teeth that are perfectly healthy might be affected. The third option is to get dental implants.
Il s'agit d'une racine artificielle en titane qui est insérée dans l'espace de la dent manquante. Une couronne est ensuite conçue et placée sur l'implant après l'intégration complète de l'implant dans l'os.
But this option requires surgery, which can lead to complications. Risks include infection, prolonged bleeding, damage to other teeth, nerve damage, delayed bone healing, jaw fracture, etc. Another con of dental implants is that the teeth or tooth will probably have to be replaced someday. Actually, they have the potential to differentiate or transform into a variety of other cell types like bone cells, heart cells, and potentially neurons. These cells can also differentiate into cells from the dental pulp to create new teeth. Stem cell research comes from a need for personalized medicine. Currently, scientists are trying to use stem cells to create new tissues to replace damaged ones in a controlled and regulated way, like the fictional Dr. Sloan here from the TV series Grey's Anatomy.
Amazing, right? Pulled a couple stem cells from the baby in utero. 6 weeks later, I have grown skin. Like God.
Scientists at Harvard's Wise Institute experimented with non-invasive laser therapy with rats to try to trigger stem cells in the body to regenerate tissue. There is increasing evidence that shows that low-level light therapy can stimulate all kinds of biological processes, but their effects have been subtle and largely inconsistent. They were hoping that the same laser could trigger human stem cells to form dentin, the hard tissue resembling bone that forms the major portion of a tooth. In the United States, the Food and Drug Administration hasn't approved any stem cell treatments for the public. This is because stem cells can be very unstable. For example, a woman looking for a facelift went to a doctor who injected the area around her eyes with stem cells. After a few weeks, she started hearing a click every time she blinked. The injected stem cells grew into the bone. Research in stem cell therapy comes from a desire to understand how the body functions and to develop personalized medicine for everyone. Thinking of all the possibilities that can come from stem cells, who would have thought that so much potential could come from a tooth?